Biologic is a specialist healthcare IT company. We do consulting, we do development for other organisations, and we also have a product area in our own company as well. We were first introduced to Leeds Community Healthcare by the Academic Health Science Network, the AHSN, who saw a service that was looking to innovate.
We identified after speaking to Biologic the first time that we had an administrative problem where a lot of our IBS patients were coming and filling in forms rather than actually having an appointment.
Some of the main challenges are around many of the healthy population that have occasional interactions with the NHS. They could easily interact digitally at home. Having decided on the use case with Leeds Community Health, we then worked quite closely with them, and I think even on the first time they saw the first form, they were pleased and impressed and could already see how this would benefit.
So once a patient's referred to us, we flag that they have IBS and they can benefit from this form. When it gets close to their appointment, we'll send that form out to their phone. We generally send it by a text message, but we can send it any way that they'd ask us to. Once they have it, it is completely their leisure to complete it. It can be completed on a smartphone, on a laptop, a computer, anything that they want to do. It's really easy to fill in. It's touchscreen for phones, things like that. Once it comes back to us, it shows us in a really structured way exactly what their symptoms are and how severe they are at that time.
So the patients send it back to us, and then it's our admin team that put it onto the patient's record, so that then when the clinicians are to see that patient in clinic, they can look at the patient's record, see that information, and then prepare for clinic accordingly. It gives me additional information so I can then prepare for that consultation as best as I can. The patient would then come to the clinic appointment, and then when it's sat down with the clinician, the information is all there ready on the system.
What we've seen is that the patients who are filling it in regularly, because they're getting more out of their appointment, they're getting the same positive outcomes at the end of their treatment, but in half the time. We've also seen that patients are coming to appointments more prepared to talk about their symptoms because they've already put a lot of thought into them. That's a really big benefit as well.
Working with Leeds Community Health has been really rewarding for the team. We've got some of our greatest successes on that project. I know that the reduction in costs and time for the staff has been huge, so we're really enjoying using that as one of our best reference sites at the moment.
The Yorkshire and Humber Academic Health Science Network was set up by NHS England to work on improvement projects and to accelerate the adoption of new technologies. The pilot and the subsequent implementation of eforms at Leeds Community Healthcare has been really successful in terms of highlighting that eforms can be used in this way and to digitise certain elements that were quite difficult to digitise. So I think it's been really successful, and it's something that we would look to use in other trusts as well.
It just means you're already interacting with that consultation before it's even started. So it's great, I think it's really positive.
It's been an incredible journey. I don't think we ever really thought it would give these kind of benefits at the time. It's really, I think, changed a way of thinking in the trust, that we need to be more open to these ideas and we really need to jump on them when they come.